Hello, my name is Ndifreke Sylvanus Okon, and this is my C464 presentation. It's a safe assumption that everyone has at some point wished for the ability to be in two places at once. On the same token, there's a sick patient who wishes they didn't have to wait in line on the organ donor list. Research suggests that continued efforts in the development and exploration of stem cell treatments, genetic cloning, gene splicing would create alternative solutions to organ repair or replacement. Current healthcare systems can use genetic research and development to achieve a reduction in the number of patients who do not successfully receive organ transplants. As of August 2017, 114,000 men, women, and children were all on the National Transplant waiting list, and of them, only 34,770 actually received transplants. This information is brought to us via organdonor.gov, and the resounding theme here is it can be done. Organoids used to study human organ function and structure at a level and detail that was previously deemed impossible have been successfully generated from embedding cells from organs in scaffold tissue and stimulating them to create fallopian tubes, brains, mini hearts, mini kidneys, lungs, more specifically bronchi, airway structures, and lung sacs, vaginas, mini stomachs, penises, an esophagus, ear, and liver cells. And this information is brought to us via lifescience.com. It is important to take into consideration one human organ donor can give up to 8 organs. One tissue donor can give up to or save up to 50 lives. This information is brought to us via upmc.com. And on average, about 20 people die every day on the organ donor waiting list awaiting an organ transplant. And this is brought to us via the American Transplant Foundation on a direct quote from technologyreview.com. This is why it's very important for us as a collective to start looking for different approaches to solving these issues at hand. Spruced up human and animal organs could someday be the solution for people needing transplants. Aaron Winnick, February 20th, 2008. Using homogeneous cells harvested from incumbent hosts can reduce the chances of the host's body rejecting the cells. Researchers at Johns Hopkins have developed a way to stimulate a rat's stem cells after a liver transplant as a means of preventing rejection of new organs without the need for lifelong immunosuppressant drugs. And this citation is brought to us via johnhopkinsmedicine.org. Immunosuppressant drugs are medications that are prescribed to patients for the rest of their life postoperatively to defend your body from your own immune system attacking the organ transplanted or the organ implanted in your body. And this information and this citation is brought to us via mayoclinic.org. Healthcare can use stem cell research to find a means of solving practical medical conditions as well, and can lead to new methods of testing for birth defects and diseases early on. Developmental disorder and birth defects start in the utero phase during a pregnancy, and we have no way to measure, or we have no measure of looking at the onset of these diseases. With human embryonic stem cells, we can recapitulate the development of the human brain and measure concrete changes when those cells are introduced to chemical drugs. And this is a direct quote brought to us via Gabriella Caesar, Stem Cells and Development via Testing Drugs with Stem Cells by Jennifer Chu, December 13th, 2007. This can be found on technologyreview.com. In theory, there is no limit to the types of diseases that could be treated with stem cell research. Given that researchers may be able to study cells cell types via embryonic stem cells, they have the potential to make breakthroughs with any disease. And this is a direct quote brought to us from CIRM.ca.gov. Stem cell research also offers new methods of testing medications without using living hosts, such as mice, monkeys, dogs, rabbits, rats, and even humans. And this is a direct quote brought to us from crueltyfreeinternational.org/drug testing. Drug metabolism in the body is a complex process. And that's a direct quote from Steve Tannenbaum, PhD, via technologyreview.com. And patients who need medical care, as specific as organ transplant using their own DNA, not only solves the problem of waiting lists, but also solves issues related to lifelong prescriptions post-operatively prescribed to these patients once they have received a transplant. It even opens the door to other medical breakthroughs relevant to disease prevention, medication testing, without putting anyone in harm's way. Using stem cell research, genetic cloning, and gene splicing, healthcare constituents can save the lives of thousands, if not billions, or an unlimited amount of patients on the organ donor list using their own genetic makeup. This medical practice also solves post-operative issues related to potential organ rejection from candidates, as well as avoiding lifelong medications, all while opening the proverbial door to finding cures for diseases and testing medications without exposing anyone to toxicity risks. We all have an opportunity as citizens to educate ourselves on these relevant topics and enroll in scholastic programs that encourage the exploration of medical practices relevant to. This opportunity to save lives gives everyone the ability to be a superhero to someone. I have visual aids that have been going through the entire production, and I'll also include a works cited where you can resource some of this information if you don't want to take my word for it. I appreciate your time today. Again, my name is Ndifreke Sylvanus Okon, and this is my presentation for C464. Thank you.